Hello friends, I am Dr. Maneesh Gupta. I am a psychiatrist and psychotherapist. I practice in Dwarka, New Delhi. Today's video is about bipolar disorder. This is a very risky disorder to have, primarily because in many patients it becomes very difficult to treat, difficult to manage, and it causes a very heavy financial, social, mental burden on not only yourself but your family, your wife, children, parents, siblings. If you are a businessman, then this impacts your business as well. Please remember, a diagnosis of bipolar disorder is a lifelong diagnosis. What it means is that the symptoms can come back anytime, and therefore at least two medications which your psychiatrist has advised must be continued for a very long time, sometimes the lifetime. I hope you understand what bipolar disorder is. It is an illness where your mental state fluctuates between two poles. So sometimes you feel very happy, energetic, overconfident, disinhibited, reckless, impulsive, lack of sleep. This is what we call as the manic phase of bipolar disorder. And then there is a down phase, which we term as a depressed phase of bipolar disorder. There you feel lethargic, low interest, no motivation, no enthusiasm, nothing seems good in life, no joy, no cheerfulness. Bad thoughts start coming in, feeling useless, helpless, hopeless. Suicidal thoughts start bothering you. But this also goes away with proper treatment. The real difficulty in bipolar disorder is in keeping you stable between the two phases. So neither the manic phase nor the depressed phase, keeping you at a stable level, a stable mood, where even if life throws challenges at you, you manage them effectively without destabilizing your mood. And for that purpose, a mood stabilizer is one of the key medicines which you must take regularly. Now this video is also meant for those who do not like taking medicines because of the side effects. Now please understand, mood stabilizers and other medicines we use in bipolar disorder can have side effects. But if you understand that your priority is to stay mentally well, then would you allow some side effects to divert you from that key direction of becoming well and staying well? For example, some of our medicines may cause hair fall, some medicines may cause weight gain, some cause sleepiness, some cause drowsiness in the short term. But if you look at the bigger picture, compared to being unwell, when you are not listening to anybody, when your emotions are not listening to you as well, when you are behaving in a manner which is very unlike you, which even you are unable to control, and when these things last for over 3 months, would you want that risk to be taken because medicines are giving you side effects? Consider this. It is important to stay well. It is important to minimize side effects. But it is more important to sustain your stability, sustain your freedom from symptoms for a very long time. And therefore, I appeal that mood stabilizers and antidepressants or antipsychotics which are used for the treatment of bipolar disorder must be taken even if they are causing you some side effects. Discuss with your psychiatrist what those side effects are. Can we minimize those side effects? Can we think of some other strategies? Maybe take medicines for 5 days out of 7. Maybe take medicines on most days and then avoid taking them on 1 or 2 days, especially when you have a meeting or a social function to attend. Maybe you could get blood tests done more regularly, just to prevent the side effects of the medicines from being apparent much later than usual, even though you and your psychiatrist is aware that some side effects may come across. But if you can monitor your bloods, if you can monitor your mood states, then maybe we can intervene much earlier so that neither the side effects bother you and nor does an episode of breakthrough mania or breakthrough depression come about. In some patients, I use another strategy, which is that when I know that for the next 3-4 months they do not have much challenges in life, when life will be smooth for them, when weather will not change over the next 3-4 months, then I do tend to reduce the medicine for a few months, knowing that they are bothered by the side effects that the medicines are causing. However, once we come closer to a period where the weather will change or the patient himself tells me that a challenging phase is likely to appear, then we would increase the doses again just to make sure that a breakthrough episode does not come about. So if you are having bipolar disorder and are troubled by side effects of a mood stabilizer or other medicine, please be in close touch with your psychiatrist at least once a month. Go back, discuss with your psychiatrist what are the problems you are facing. Another alternative strategy is of psychotherapy. Sometimes you have minor mood swings. You become angry at times, you become low mood at times, and these are partly because of your exaggerated responses due to bipolar disorder to minor ups and downs in life. This can be very well supported in therapy by your psychiatrist who knows that medicines may not be required to change. What is required is listening, empathetic, non judgmental listening. What is required is clarifying, rationalizing that your anger is justified, but its expression on others is something which you can try and avoid. And how do you do that? Then strategies can be discussed. Or if your strategy involuntarily is of avoidance, not going to office, becoming absent from work, then we will offer you different options. Medication reduction, using supplements, maybe graded exercises or activities which can help you regain the feeling of well-being without an increase in medicines. But again, you have to work closely with your doctor, telling them all that you feel, ins and outs, and meeting them as often as is required. Sometimes once a month when things are stable, and sometimes once in 4 days when things are not so stable. So keep that in mind, but keep the focus on getting well and staying well.